It is the mission of the century to vaccinate Filipinos against COVID-19, a daunting task in a country like ours, 109 million people scattered in over 7,000 islands, some who live in mountain communities that can be reached only by foot, where the healthcare system is weak and facilities far too few. How will Filipinos in remote and isolated communities get the shot?
Sambuanga, Basilan, Hulo, Tawi-Tawi.
Once the vaccines arrive, it is all hands on deck, a historic undertaking of the national and local government, with healthcare workers, uniformed personnel, the private sector, and volunteers all on the front lines.
You will be the grassroots implementers of our vaccine program.
A foolproof game plan from all the way up north to all the way down south, from the island of Batanes to the island of Tawi-Tawi. There is no room for error, our one shot to fight COVID-19.
I'm Pia Hontiveros. We'll be asking the hard questions for stories that matter to you. Front and center is the vaccine game plan, a massive operation by land, air, and sea to bring the COVID-19 shots from city centers to remote communities, among them the mountainous and isolated regions of northern Luzon, home to at least 10 million people, and the far-flung areas of Mindanao, where healthcare facilities and transport to island provinces are extremely limited. The country is embarking on the biggest immunization drive yet in history. Private companies are helping bring the vaccines from the metropolis to rural communities. Front and center now is Rosemary Rafael, president of Airspeed International, which was also the government's logistics provider in the first national automated elections back in 2010. Ms. Rafael, thank you very much for joining us on the show. Let's begin with this. Now, if you were to describe, ma'am, the work you did for the 2010 elections, how would you compare it to the task that looms ahead of you in this vaccine game plan?
Well, this one, I call it as a mission because it's all about saving lives. We'd like to be able to bring and deliver and make the vaccines accessible to a bigger population here in the Philippines. As you know, we have to have a reach of about 70% to 80% to come up with the herd immunity. So as I can't remember who said that, Pia, but somebody said nobody is safe unless everybody is saved. So this is a mission. This is a mission for us to be able to participate. It is a milestone in the country. Just like what you said a while ago, it is a mission. And this is something that can be accomplished only if and when everyone, the private companies, the public companies, the LGUs, our government, all of us doing this together. That's the only time it can happen.
Mm-hmm. Well, ma'am, let's take that mission front and center. Can you be more specific, ma'am, when it comes to areas that you'll be servicing and exactly what functions are you going to be performing? Are you at liberty to tell us that?
Actually, this is going to be an effort of many other people or many other institutions. What's going to happen is that from the DOH is ordering or procuring the vaccines from several pharma companies. And once this is done, these are going to be transported by air to Manila. And as soon as it is sent out, we get a pre-alert, and then we know when it's coming to Manila, and then we clear the shipment at customs. And as you know, our president is saying that there's going to be no delay in the clearance of the vaccines because of its sensitivity. For different pharma companies, there are different ways of handling it. There are temperature-controlled environment that is needed. That's why we also prepared for the packaging and how it's going to be handled. And we have to coordinate also with the pharma companies on the intricacies or the requirements that's needed to be able to transport it. Once it arrives to Manila, then this is going to be transported, and it's going to be done in tranches or in phases, because as you know, the sensitivity of the vaccines, this can be uh, brought in for a number of days only, and it has to be administered. So it is really a coordination. There's really preparation and planning with the LGUs, with whatever institution or vaccination centers that's going to be used, and the arrival of the vaccines, because we have to match the number of vaccines that's going to be administered on a particular day. As you know, the vaccines can be exposed if it's not used. For example, we have like 500 vaccines that's going to be administered for a particular vaccine center. If, let's say, the people who arrive will only be 400, the 100 cannot be used, that's already exposed and cannot be used anymore. So there's a lot of coordination, not only just in logistics, but also with the LGUs, with the vaccination centers, with the DOH, and also private institutions.
Ma'am, when you came up with this foolproof plan, of course, you had to consider all the challenges that are going to come up. Well, we all know what it's like. No, halimbawa, we order things and we know that there are problems when it comes to delivery, for example. Can you be specific? Describe to us, illustrate to us what are the possible challenges and problems that could crop up. No, apart from the fact that syempre time-bound, syempre yung mga delivery ng mga vaccines. So, ano yung mga tinitingnan nyo as logistics providers?
Time and motion. That's why there were simulations in the past, because we have to look at the time and motion. But time and motion is also dependent on the time of day that you are going to deliver, how it's going to be received in the vaccination center or the immunization area, how many people are going to be there to be able to administer the vaccines. These are the things that we're looking at. In terms of the traffic or how fast it's going to be, I don't see any challenges within the cities. I don't see any challenges because I am positive that MMDA, everybody's participating here, Pia. Nobody is like, everybody has a hand on it. Mm-hmm. So MMDA will be helping. Bureau of Customs will be helping. As long as they know these are vaccines, they know that this is urgent because this is for the lives of our people. And the challenge that I'm looking at are the areas that's difficult to reach. Those are the challenges.
Well, like you said, Ms. Rafael, at the start of the interview, you said that this is a mission and this is all about saving lives. And, you're not just bringing vials of vaccines. What you're bringing really is hope. And I wanted to say thank you, not just for this interview, but for what Airspeed International is going to do for this effort. Maraming salamat po sa inyo, Rosemary Rafael, President of Airspeed International. A historic undertaking to give every Filipino a shot in the arm. We will speak with the health departments in the Cordillera region and the Cagayan Valley region. Plus, more boots on the ground in the war against COVID-19 as the military positions to bring the vaccines to isolated communities in Mindanao. The vaccine game plan is front and center. Stay tuned to CNN Philippines. We keep the stories that matter front and center. I'm Pia Hontiveros. Welcome back to the program. Managing cold chains is just one logistical challenge in the vaccine game plan. Bringing the vaccines to isolated communities in northern Luzon is another. Just like in the Cagayan Valley region, which covers the island province of Batanes, the mountainous provinces of Quirino and Nueva Vizcaya, and the valley provinces of Isabela and Cagayan, and the Cordilleras, a landlocked mountainous region home to the Cordilleras Central Mountain Range of Luzon, the largest in the country. More than a third of the region is 1,000 meters above sea level and 85% forest land. The region is comprised of the provinces of Apayao, Kalinga, Mountain Province, Ifugao, Abra, and Benguet, and the nation's summer capital, Baguio City. Now, how will the rollout look like on the ground? Front and center are the regional health departments of these regions, DOH2 Regional Director Dr. Rio Magpantay and DOH Cordillera Medical Officer Dr. Ana Cris Kilakil. Let's begin with Dr. Kilakil, who joins us from Baguio City. Thank you very much, ma'am, for agreeing to this. I wanted to go through very quickly, very briefly, these challenging areas that you listed in the Cordilleras. Let's begin with the province of Apayao. You talk about Calanasan and Cabugao. Can you tell us why these are challenging areas, describe them to us, and what kind of an impact that will have on the vaccine rollout and deliveries? And what are you going to do? Are you going to bring all the vaccines to the remote areas, or are you going to bring the people from the remote areas to the town centers, the poblaciones, for example?
Yes, Ms. Pia, thank you very much for that question. So basically, the provinces of Apayao, Benguet, Kalinga, and Ifugao, they have several municipalities that are really very isolated and very dependent on the weather conditions for operations or on how we give the essential services. So these areas have several rivers that you need to cross before you go to their other barangays, although their capital towns are basically accessible, but some of their barangays are really very isolated that you would have to depend on your your feet to go there, and on some water transport so that those areas may be reached. So how do we plan to get the vaccines in these areas?
Specifically Apayao, ha?
Yes po.
Yes, specifically yung Apayao.
Yes,
What we want to do kasi is to make this as visual as possible para maintindihan ng tao yung hirap na dadaanan natin lahat. Na dadaanan ng gobyerno to bring those vaccines to those areas. Apayao, the towns of Calanasan and Cabugao. Ito ba, kanina sabi nyo, very weather dependent. So halimbawa, umulan. Pag umulan, hindi nyo na siya mapupuntahan? Ganun po ba?
Yes po. And it will also be dependent on the road networks because these areas are very, very prone to landslides. And if there are present landslides because of the weather condition, then you cannot really access these areas. That's why it will cause a really significant delay if we are talking about vaccination operations. So most of our campaigns before actually were really dependent on this.
Okay. For Benguet, Dr. Kilakil, you listed the towns of Kabayan, Bakun, Bakun, Kibungan, and Bugyas. Bakun and Kibungan are on the east side, bordering Ilocos, Kabayan and Bugyas, west side bordering Ifugao. Why is it going to be a very challenging area for you?
Yes, because these are purely mountainous areas, and some of the barangays here, you need to walk through other provinces for you to access them. So we are also considering those circumstances for this vaccination program.
Okay, you said walk through, meaning walang road network, Carabao Road at best, clearings in mountain paths, for example, ganun po ba?
There are actually trail roads where people can also access these areas. However, other barangays, not all of the barangays have roads within that province. For example, po meron po tayong ibang areas that you need to go through the province of or the municipality of Cayapa in Nueva Vizcaya for you to also go there, and of course some other areas din po. Yes po.
Well, thank you very much, Dr. Kilakil. Please stand by. I'm going to speak now to Dr. Rio Magpantay of DOH Region 2, the Cagayan Valley region, who's joining us from Quirino Province. Dr. Magpantay, you listed Palanan, Dinapigue, Macunacon, Calayan for Cagayan Valley. These are coastal areas, and if you go to the center of Cagayan Valley, of Isabela, when you move to the right towards the west, Sierra Madre Mountain Range muna, and then you have the coastal area towns. Is that correct? And that is why you list them as challenging areas?
Most of these areas, in fact, if not all, can be reached only through plane. And especially if the weather is not very good, even the planes cannot be utilized for us to be able to reach them. That's why these are very challenging areas for all of us here in Region 2, especially in this COVID-19 vaccination plan of ours. However, we have alternatives already for this. If in case the weather is very good, we have contracted a third party already through either land, if this could be reached through land or through plane, because meron naman pong chartered planes dito sa Region 2 which we could utilize. And we already have talked to the owner of a particular private company owning these planes.
Okay. There are a few other areas, for example, there in Quirino where you are, Nagtipuan as one of the geographically isolated and disadvantaged areas. Two towns in Nueva Vizcaya, Alfonso Castañeda and Ambagyao. And then, of course, the island province Itbayat in Batanes. Describe to us what your plans are for these areas and how you're going to make sure that the vaccines get there.
Nagtipuan is actually the farthest municipality of Quirino. It is very mountainous. However, this could be reached naman through land, by land, kung wala naman po tayong ulan. The only problem is the weather condition. And if it's going to be this first quarter, I guess the weather condition is better. So we could be able to reach this particular GIDA areas through land. This is also true for other areas that you've mentioned in Nueva Vizcaya, for example, Alfonso Castañeda and Baguio. The problem with Itbayat, Batanes, is that it is 2 hours away from Basco through boat. However, if the plane is available, we could also utilize the plane to be able to reach that particular island. And since as I have said, pwede naman po kaming mag-charter ng plane, and we already have identified funds for that, then magagawa po naman namin yun. So I guess, as I've said, these are challenging areas in the sense that in case the weather condition is not very good or there are certain other issues that we have to tackle, sila po yung mahihirapan po talaga kami. However, as of today, hindi naman po sila ganon katindi ang ang difficulties para po ma-reach namin dito sa Cagayan Valley.
Kanina tinanong ko rin kay Dr. Kilakil ng DOH Cordillera, no, kung yung mga tao ba, dadalhan nyo sila ng vaccines or papupuntahin nyo yung mga tao mula sa mga liblib na lugar, papunta doon sa mga poblasyon o sa mga town center. Sa Cordillera, ang sabi ni Dr. Kilakil, talagang they will make sure na hindi ma-inconvenience ang tao, talagang dadalhin sa kanilang mga bakuna. Kayo po, sa Region 2.
Kasi we have chosen our implementing sites po. Ibig pong sabihin nun, we have to follow certain guidelines in choosing the implementing sites. Kailangan po ilagay po natin yung mga implementing sites sa mga areas kung saan maraming talagang mga vaccines na pwede po nating bakunahan agad, as well as conducive po talaga na madali pong mapuntahan ng ating mga tao. However, siyempre we have a plan in case people who really cannot come to that particular implementing site, then we have to make sure that we have an alternative in making sure that the vaccines reach their areas, even without them going to the implementing unit or site.
Well, thank you very much for joining us, Dr. Rio Magpantay of DOH Region 2, the Cagayan Valley region, and Dr. Ana Cris Kilakil of DOH Cordillera. It's good to hear na everything, you've put all your plans down in black and white and everything is ready. Yung bakuna na lang ang hinihintay. Sana dumating na kaagad. Salamat po, Drs. Magpantay and Kilakil. The stories that matter are front and center, from the remote communities of northern Luzon to the isolated areas of western Mindanao. A look into the vaccine game plan down south. Stay tuned to CNN Philippines. Okay. There are a few other areas, for example, there in Quirino where you are, Nagtipuan as one of the geographically isolated and disadvantaged areas. Two towns. Welcome back to Front and Center. We want answers on the stories that matter to you. I'm Pia Hontiveros. The Health Department has designated Davao as a regional vaccine operations center. But how will the COVID-19 shots reach island provinces and other far-flung communities in Mindanao? Front and Center is Western Mindanao Commander Major General Corleto Villuan, joining us from Camp Navarro in Zamboanga City. West Mincom, of course, covers the Zamboanga Peninsula, Basilan, Sulu, Tawi-Tawi, Central Mindanao, and parts of Lanao. General Villuan, sir, thank you very much for being with us. You told us earlier that you are still waiting for the plan, yung final plan or scheme of the regional health units so that you can put together a foolproof vaccine game plan for distribution. Can you tell us what you're expecting in the next days? You're supposed to have a meeting tomorrow, is that right?
Yes, we will be having a meeting tomorrow with the Chief Minister of BARM for the rollout of the vaccines. But yesterday we had a meeting with the Region 9 Regional Vaccination Operation Center, which was attended by my focal person. At yung meeting includes the cold chain facilities, yung simulation exercise for the transportation, storage, and distribution and administering of vaccines, and then some of the challenges in the transportation of vaccines. But for now,
General Binduan, when you say
I have,
challenges in the transportation,
especially in the
sorry, go ahead.
provinces
You were
of,
saying for now you have.
for now, I have organized a technical working group, organized headed by my deputy commander for this vaccination program. And for the challenges, yung nakikita ko dito, yung transportation of vaccines doon sa island provinces, especially in Tawi-Tawi and Sulu.
So anong mangyayari? What's going to happen? Ang gagamitin mga barko will be what? How are we going to do this? Or is it going to be by water, over water, or by sea? I'm sorry, by air.
Aircraft. We have aircraft and naval vessels to include the Philippine Coast Guard vessels. So I have already instructed the Naval Forces Western Mindanao to prepare his vessels for in case the Department of Health will ask us to transport the vaccines. But for the transportation
So
of
basically,
vaccines but for the transportation of the vaccines from Tawi-Tawi to island municipalities, especially in the Turtle Islands, doon sa Taganak Island, kailangan natin yung Navy talaga. Hindi kaya wala kasi tayong airfield doon eh.
Okay. Pero meron ding, bukod sa Coast Guard, meron ding PNP Maritime Command halimbawa. Pwede po ba yung mga barko nila?
Ayun, gagamit natin yung PNP Maritime. But siyempre, depende sa volume ng vaccines na dadahin dun sa island municipalities.
Okay. Kanina lamang, General Binduan, sabi nyo yung mga challenging na areas nyo is yung mga island provinces na either by air or by sea. What about yung mga by land na transportation? Do you see any security concerns, peace and order concerns when it comes to transporting these? Because, for example, the Communist Party of the Philippines has talked about how they would prefer na Red Cross daw ang mag-transport ng vaccine. Or if yung AFP daw ang gagawa, kailangan daw may malinaw na makikita, may mga nakapaskel na mga signboard na ang dala nyo ay mga vaccine halimbawa.
Yes, other areas naman are accessible by land. But of course, we will also consider yung security aspect. So we have to coordinate especially with the Peace Incline Armed Group to help us disseminate to the community.
Well, thank you very much for joining us, the Commander of the Western Mindanao Command, Major General Corly Vinluan. Salamat po, sir. So Is mission impossible even possible? Can the government manage and deliver to even the remotest, far-flung places? We don't have a choice. Everyone knows each of those vials of vaccines brings hope, and it is everyone's job to make sure that all their hands are on deck. Not a moment to lose, not in this pandemic. This is Front and Center. I'm Pia Hontiveros. Join me again at 8 tonight for my exclusive one-on-one interview with the Vatican's envoy to the Philippines, Archbishop Charles John Brown, as we prepare to celebrate 500 years of Christianity. Stay safe and good night.